Should you be tested for inflammation? A comprehensive guide. Inflammation is one of the body's essential defense mechanisms. When you scrape your knee or catch a virus, your immune system responds by sending white blood cells to the affected area. This acute inflammation helps protect and heal your body. However, when inflammation becomes chronic, it can silently fuel numerous diseases, ranging from heart disease and diabetes to arthritis, cancer, and even depression. Because of its association with so many health issues, a growing number of people are asking, should I be tested for inflammation? Let's break down what inflammation really is, how it's measured, and whether getting tested makes sense for you. Understanding inflammation. The good and the bad. Inflammation is a biological response to harmful stimuli, such as pathogens, damaged cells, or irritants. It plays a crucial role in healing injuries and fighting infections. There are two main types. 1. Acute inflammation, short-term and localized, often accompanied by visible symptoms like redness, swelling, heat, and pain. Think of a sore throat or a twisted ankle.
2. Chronic inflammation, long-term and often invisible. It can persist for months or years, slowly damaging tissues and contributing to many chronic illnesses. Chronic inflammation is often called a silent killer, because it doesn't always cause symptoms until significant damage has occurred. What causes chronic inflammation? Chronic inflammation can be triggered by a variety of factors, including poor diet, high in sugar, processed foods, and trans fats. Sedentary lifestyle. Obesity. Chronic stress. Environmental toxins. Smoking and alcohol use. Untreated infections or autoimmune diseases. Left unchecked, this persistent state of immune activation may erode your health over time. How is inflammation measured? There's no single definitive test for chronic inflammation, but several blood tests can serve as indicators. C-reactive protein, CRP. This is one of the most common markers. High sensitivity CRP, HSCRP, is especially useful for evaluating cardiovascular risk. Erythrocyte sedimentation rate, ESR, measures how quickly red blood cells settle at the bottom of a test tube. A faster rate can indicate inflammation. Fibrinogen, a clotting factor that also rises during inflammation. Interleukin-6, Illinois-6, and tumor necrosis factor alpha, TNF-alpha, these are cytokines, proteins that play a role in immune responses. Elevated levels may reflect chronic inflammatory activity. White blood cell count, WBC, an elevated count might signal infection or inflammation. Should you get tested? The answer depends on your overall health, symptoms, and risk factors. Here's when testing might be a good idea. 1. You have a chronic illness or autoimmune disease. People with rheumatoid arthritis, lupus, inflammatory bowel disease, or other chronic inflammatory disorders should be monitored regularly to track disease activity. 2. You're at risk for heart disease. If you have a family history of cardiovascular disease, high cholesterol, high blood pressure, or diabetes, a test like HSCRP can provide additional insight into your risk. 3. You're experiencing unexplained symptoms. Fatigue, body aches, low-grade fever, brain fog, or digestive problems may be subtle signs of chronic inflammation. Testing could uncover an underlying cause. 4. You're interested in preventive health. Some people use inflammation testing as part of a holistic health assessment, especially when taking proactive steps to manage lifestyle and diet. 5. You're dealing with mental health issues. Emerging research links inflammation with mood disorders like depression and anxiety. While still a developing field, some psychiatrists include inflammation markers in diagnostic workups. Who probably doesn't need testing? If you're healthy, asymptomatic, and have no major risk factors, routine inflammation testing may not be necessary. These tests are not typically part of standard checkups unless there's a specific reason to investigate. It's also worth noting that results can be influenced by temporary conditions, like a recent cold or injury, making it important to interpret them in context. What to do if you have high inflammation levels? If your test results show elevated markers, don't panic. It doesn't automatically mean you have a disease. However, it is a red flag worth investigating. A doctor will consider the full picture, including medical history, lifestyle, and other test results. In many cases, you can reduce inflammation through lifestyle changes. Adopt an anti-inflammatory diet, rich in vegetables, fruits, whole grains, fatty fish, nuts, and healthy oils. Exercise regularly. Maintain a healthy weight. Manage stress. Get quality sleep. Avoid smoking and limit alcohol. Sometimes medications like NSAIDs or corticosteroids may be prescribed, especially for autoimmune or inflammatory conditions. Final thoughts. Inflammation is a complex but crucial aspect of your health. While not everyone needs to be tested, it can be a powerful tool for understanding and managing chronic disease risk when used appropriately. If you're concerned about inflammation or have a family history of related conditions, talk to your healthcare provider about whether testing is right for you. The more you know, the better equipped you are to make proactive choices for your long-term health.